our symposium was mainly about genetics and genomics and bone marrow failure, which is, again, a disease that prevents you from building or from producing healthy blood cells. And I think what kind of the main message was that I think we've made a lot of progress in understanding these diseases a lot better. And we also had, for example, one talk that was about one of the predisposition genes that, like you can have as an inherited predisposition to bone marrow failure, MDS. One of those genes, DDX41, there was a talk about that, and it was really impressive because they collected about 9,000 patients, so that's a very, very large cohort, and they were able to actually correlate that with different clinical characteristics and also prognostic factors, which I think will make a huge impact on the kind of treatment that these patients will receive in the future. So that was one of my highlights.
And I think that what is becoming evident now as we move forward with the improvement of genetic diagnostics and the improvement of assays, how we can actually diagnose the genetic mutations, even on single cell level, not in thousands of cells, but in single cells. What becomes evident is that many of the patients with bone marrow failure syndromes have somatic changes or acquired changes in the bone marrow that might be protective. That means that might alter the phenotype, the disease course, and they might improve the blood production, for example. So we know about this from SAMD9 and SAMD9L syndromes, which are germline disorders that predispose to MDS, where the stem cells can kind of undergo a natural genetic therapy and select for the hematopoietic stem cells that are repaired or rescued. And the same phenomenon can happen in disorders such as dyskeratosis congenita, which is a telomere biology disorder group. For example, one of the highlights that I found from this, from our session, was that in patients with TNF2 germline mutations, which is one of the most severe subgroups of telomere biology disorders, that these patients had acquired changes in the marrow in another gene called POT1. And I think this is very fascinating to see and understand how these additional changes improve the fitness of the stem cells. Additional talk was about these clonal or acquired changes that might be protective in Fanconi anemia and Shwachman-Diamond syndrome, where increasing amount of patients is being discovered with these changes that might again actually be protective and not necessarily drive the disease towards leukemia.
Yeah, and one other highlight that I think is also going to really improve kind of the variant interpretation, meaning like whether or not a specific variant that we're finding when we do those genetic tests is causative or not, or like pathogenic or not, is a database that actually was developed at St. Jude's for those SAMD and SAMD9L variants, because the really kind of hard part about interpreting those variants is that they're all private, meaning they're, like there's one unique family. They're not shared between families. So we see those variants, it's really, really hard to tell if they actually cause the disease that we're seeing. So that will really improve variant interpretation actually all across the world, because we've got that database of all the variants that were found across all different patients. So that was another highlight that I just wanted to point out.
And I would like to point out one highlight from your presentation, which is that, and this is how what you mentioned about the power of international collaborations and large databases comes well into the game, because you were explaining about the problematic issue of the so-called variants of uncertain significance. So up to 90% of the genetic changes we identify using next generation sequencing methods might be variants of uncertain significance. So that means we do not really know what they really mean. And through these databases, we can actually reclassify them and provide a better kind of suggestions to the clinicians what these variants mean. Right?
Yeah. So I think, for me personally, I think there are two take-home messages. One is really that we're trying to understand those bone marrow failure syndromes, meaning we're trying to understand the whole biology, like how, what is causing them, what makes you progress from, bone marrow failure to like MDS, which is a pre-leukemic state, or even actually acute leukemia. And also we're really making some, I think, improvements in terms of treatment, and also especially for aplastic anemia. I think some of the highlights were also like trying to find the best standard of care treatment, and there's some really large studies that have now been started. So I think that is really something that will greatly improve our understanding and also the treatment of those bone marrow failure syndromes. And another point, obviously, for me, coming from a genetic background, is that I'm really thrilled that we've got those collaborations. And in general, this is a very collaborative field, and a lot of groups are working together. And I think this is the only way to solve the patients with a clear evidence of some hereditary disease, where we just cannot find any causative variant to date. So that is kind of my outlook for the future, that we'll be able to do that through that collaborative effort.
Although, Simone, I think if I might add to your statement about the germline or the hereditary mutations, I think we are now moving from the phase where we kind of identified most of the germline mutations. Of course, there are still new genes to be discovered, but we are moving towards kind of disease-modifying changes
Correct.
in the genome
Yeah.
that might be germline, hereditary or acquired. Maybe you could expand on that.
Yes, that's another really good point, because what also actually was apparent from our symposium, that people with these variants in the DDX41 gene, they actually, not all of them get the disease, right? So it's like a penetrance, meaning like, the percentage of patients who actually get sick when they're carrying the specific variant is 40%. So that is not, obviously not 100%, that's even less than 50%. And that's exactly what Marcin was kind of pointing to, is the fact that we don't know to date why some of the patients actually develop the disease and some do not. And there may be many different genetic modifiers, as he mentioned, that actually, are important. And that's another, I think, advancement in the field, that we're working on that and trying to figure out what is causing the disease, and maybe potentially even preventing it in the future.
So for me, as a pediatric hematologist specializing in the rare bone marrow failure syndromes, one of the most important aspects that comes through this symposium is the power of international collaborations. We have seen really a great improvement in patient outcomes through multinational studies, where several countries were involved, and this really resulted in randomized trials that we would have not been able to achieve before as a single center experience or even as a single nation experience. So I think this is one of the most important aspects, and a meeting like that really bridges these different countries and provides kind of, I think, a benefit to the whole scientific community, to the clinicians, and to the patients.
I think overall that, your care definitely improves by participating in a clinical trial, and also obviously those registries, as we talked about, even the databases with specific variants. I mean, that is really something that I think can only help you, your family, and obviously all other families in the future.